is a major problem in our Ghanaian community, and I think it's a major problem across the African communities. It's seen as a taboo. They don't discuss it. It could be depression, it could be anxiety, it could be tiny little things that we've realized could also build up. I would use an example of crime in our communities continue to increase. And it's increasing because some of these children are suffering from mental health. Since COVID started, we've seen an increase in our community members experiencing stress, experiencing financial problems, and we have community members who are homeless now. There are those who have no food. And all of these things become stresses in the community, leading to more violence. So this project really is for us to be able to look at the current mental health toolkit that is available and that others are being trained on, and to see how we can restructure it to help meet the needs of our African community as well as our Black communities. We have a team who are mental health experts. We have psychiatrists, psychologists, social workers. We have also educators who are looking at the current toolkit, and they're looking at what maybe they can improve to help meet the needs of Blacks. Once they review that toolkit, we intend to teach or train more people in the community. So it's going to be train-the-trainer model, where we train our community members who will then train their community members to be able to increase the capacity of our trainers or our mental health supporters in the community. Culture is very important when it comes to the African community, and so trying to make sure that our trainers incorporate some piece of the culture is key, and that's something that we know that the mental health toolkit currently does not have, that it doesn't focus specifically on the culture. And so in us reviewing the toolkit, we are hoping to incorporate culture in it, so that when we are providing support to an individual, we understand the culture they're coming from, we understand the religion that they're coming from, or the beliefs that they uphold, so that we can provide the best possible support for our community members. Our goal is to be able to train at least 500 people in our community who will focus on providing mental health support to the Black communities. I often think access to care is one of the challenges that we're faced with, where when someone is experiencing mental health, they have no one to talk to, they have no one to go to. And so in us educating leaders in our community, if these leaders are trained on how to provide care for someone who's experiencing mental health, we're able to combat this challenge in our communities. So our goal is really to have a safe community. The start has been amazing. Ever since we sent requests out to the community, we've had a vast number of people expressing interest to participate. I'm very excited to learn from and with all the different communities across Canada. This is something that I believe that when we all come together, we can accomplish so much.